Welcome to the Bullitt County Health Department's Diabetic Defenders Workshop Series. We are so excited that you've chosen to join us. Diabetes health education is a very important topic here at the Bullitt County Health Department. In Kentucky, over 14% of the adult population is already diagnosed with diabetes. That's twice as high as the population amount in 2000. Kentucky currently ranks 13th in the nation for the adult population with diabetes. Because of these numbers, the Bullitt County Health Department has taken an initiative to help defend our diabetes population here in Bullitt County. We have created this workshop series to help build the skills that you need to take control of your health and take control of your diabetes care management. We want to welcome you to this recorded workshop series hosted here at the Bullitt County Health Department in November of 2024 for Diabetes Awareness Month. Please be sure to listen to all 4 series workshops as they were very helpful and equipped each and every resident that was able to attend with the skills that they needed to take control and become a diabetic. Okay, we're ready for you.
All right, good evening. Welcome. It was a pleasure to come out and talk to you all, especially the residents of Bullitt County. When Jamie invited me several months ago, I'm like, that's a perfect time to do it right before the holidays when people just eat bad stuff and things get out of control. So it's good to get it educated right before the holidays and all the stress. And when we're stressed, we eat more bad food. And I think education is a very important in terms of preventing and treating diseases. I wish we have more options to do something like this. And like I told Jamie, anytime you need me, just we'll commit any of our resources to the community and talk. I always love teaching. In my office with my patients, I always not like teaching. And I think the educated patient is a better patient. And if patients aren't educated, in my experience, they really don't follow instructions really well. And then their care gets poor and then they run into trouble and complications. So I think the educated you are, the more you understand it, the better off. Like if a patient comes in my office, I explain to them if their foot is broken or not, show them on x-ray, because when you see it, I guess it makes a connection versus saying, oh, your foot's broken. You need to do this, and they won't do it unless they see it themselves. There's a lot of facts on that paper that I don't want to bore you with, but we all know that diabetes is a very dangerous disease, and especially in this country and all over the world for that matter. But in this country, it's become a silent killer. I think it's more dangerous I always tell my patients that diabetes more dangerous than cancer because it's a multi-organ disease that affects every single part of our body. So the good thing is it's preventable. If we are educated and we do these kind of outreach programs and seminars, we could stop it and slow down the progression. Things like cancer, other like tumors and stuff, some of it's you can't do anything about, but this disease we can at least do something, if we know how to address it. And I just wish more providers like primary care specialists like myself or dietitians kind of have a community outreach, like a group therapy session. I think that'd be very important to educate patients like as a group, so all these different doctors can kind of put their input in. I think that's very kind of an important way to teach. But have you, both of you, ever been to a foot doctor's office or know anything about what we do? Or okay. Oh, okay, gotcha. Oh, I'm not sure. We'll see. But okay, yeah, I know her very well. So yeah, we see diabetics, like the low risk diabetics, we in our office twice a year for like a diabetic foot and ankle checkup where we completely go through all their different parts of their feet and ankles, make sure circulation, sensation, no sores, all that stuff is kind of addressed. X-rays if needed. So but our yeah, most insurances recommend. Most insurance recommend at least like a like you go for your primary care like a well child or well visit. They recommend you I think go see a foot doctor once a year for a foot exam just to make sure everything's good. Because primary care sometimes is so busy that they may not have a chance to even have you take your sock shoes off and look at your feet, and a lot of things can get missed. And prevention is way more easier and less expensive to treat than having a sore and then addressing it after the fact. Also very important on this subject is eye vision. I always tell patients make sure you go to see your eye doctor once or twice a year and a foot doctor. And we have other services that we in our office for any patient, but for diabetics, we also have a diabetic shoe program. And like I said, we take x-rays and stuff. So we do a lot of stuff comprehensive for diabetic patients. Patients sometimes when they don't know, they go to other like primary care or or they don't come in to see what they can do actually. But there's stuff we can do. You don't have to like live in pain for like neuropathy pain. When patients can't feel their feet or they get burning, numbness, tingling, it affects their quality of life. And we do patients, when they come in with infections and sores, and then the amputation risk goes up. So I always think prevention is very important than treatment, in my opinion. But do you guys have any questions about like how would we treat or anything?
So the neuropathy in your feet that you were just mentioning, so my feet are starting to do that, and it's going like up like midway. But is there any way to count, like stop it or like go backwards?
Reverse it, you mean?
Yeah.
It all depends on how severe your neuropathy is and how quickly is onset. Uh, Obviously, blood sugars plays a very important role in controlling how well your neuropathy will be treated. We could put all the medications in your system orally or topically, but if your blood sugar is out of control, you don't take care of your diet, morbidly obese, those things will counteract and will not help us treat your neuropathy. So, like I said, it's a multifaceted approach. Like the same thing with ulcer. Like for example, if a patient comes in with an ulcer, not healing, getting worse, or infection, there's other underlying factors. Like a patient smoking, their blood sugars are in the 200 range. They're not exercising, so there's medication they're not complying with. So you have to do the whole big picture and always educate the patient. You have to make sure you do all those things. Whether I could put like a different graphs on there, all everything, but it won't heal. So I mean, it's all connected and um, very important. That you control your health. And diabetes is one of those things that every day is a different day, right? And every month can be changed. So always example I give to my patients is diabetes. You want to make sure you check. It's like driving a car with an oil leak in the engine. You never know when that oil is going to be completely empty and that engine's going to stop. So it's very important with your foot and ankle. I mean, make sure everything's tip top shape. Make sure your circulation's good. There's no problems with circulation. Neuropathy is not way out of control. No sores or pre-ulcerative lesions or anything. Welcome. No, you're fine. You're fine. Um, and I always tell patients, look at your feet every day. Very important because you may not be able to recognize certain things. And if you can't see, have your partner look at your feet or maybe put a mirror on the floor and just kind of see. Because sometimes patients can get sores and they come in my office like several days later and it's like, oh, I got a piece of glass in my foot or I stepped on something, I got a sore. It happens all the time and full blown infection, and then we got to take them to the hospital, and it just really becomes a bad issue quickly. And with the diabetics, when the immune system is already weak with the diabetes, an infection can become full blown overnight. We see patients like for an ulcer, like one day it looks really good, and then a day or two later they call me and say, Dr. Patel, the ulcer is really bad, and they're right, and it's really bad, and for some reason it just got out of control, and then we got to admit him in the hospital. So it's very important. Things can get out of control quick in a diabetic patient. So it's very important. You recognize those signs of anything that's going wrong with your foot and ankle, because your body will tell you if anything's wrong. You just gotta pay attention and look out signs. If you notice increased swelling in your feet or ankles, or if there's an area of redness, or if you feel heat, or if you notice a sore that's just there, don't wait a second. Go to the foot doctor's office, or if it's after hours, immediate care or primary care, but get treated right away. At least let somebody look at you, document you, prescribe you, because if it could get out of control, it becomes a bad issue. So that's something that's very important. I always tell my patient, just have a strict control of what's going on. On that token, I always tell patients not to go barefoot in the house, because even if there's carpet, there could be things on there like dirt or like any foreign body can. Because some of our patients that are fully neuropathic, they cannot feel nothing on their feet. So if they step on a foreign body, or they won't notice it, and they could become a nasty infection or sore. So I always tell them, get some dedicated slippers in the house to wear, so that way at least you're protecting your foot against the surface. And we always tell patients that if they have neuropathy, always check your hands with in the shower with your hands so you don't burn the skin on your feet, because you could get third-degree burns on your feet, and if you jump in a hot shower right away, so a lot of simple things that we non-diabetics take for granted. I always tell diabetics, you got to really be focused. Never let go of the gas on the pedal. You always have to be always on the watch, because it's a constant battle. You just want to make sure, and the good habits start early. My type 1 diabetics that I see once a year, young kids or teenagers, We always, make sure they get the proper, guidance, and they get that etched in their mind so they know what to watch out for, because they got a long ways to go, and we just don't want any future complications from any type of ulcer amputation. And a second thing I was going to lead into the diabetic shoes. Some patients may qualify, and not everybody does, but if they do qualify, diabetic shoes are very important. I wish I could have brought all my stuff to show you, but shoes are very important. A properly sized shoe can go a long way, along with diabetic socks. The properly sized shoes can prevent sores, can take some of the pressure off your feet, and make it easier to wear them. So that makes them diabetic shoes special versus regular shoes. And sometimes I measure patients for shoes. Shoe size could be totally different than what they're wearing. So they could be wearing the wrong size all these years, too tight, or not the proper style. So it's very important to at least ask us, what's the best shoe for my foot. So we could give you some guidance and advice on that. Socks, diabetic socks are different than regular socks. They're more comfortable, thicker. They won't cause the intentions on your calf, like a regular sock would be. So you could get some on Amazon. We have in our office. But diabetic socks are very comfortable and they're antimicrobial. Some are really nice, have silver in them, so it keeps them antibacterial. So does that make sense? I know there's a lot of information I'm throwing at you all, but some of it, is very important. Most of it's important, all of it, but it's some of it is a routine. I do this day in, day out, every day, so I'm kind of used to it. But some of it's different, language for you also. Just stop me if I'm kind of going too fast, or if you don't make understand what I'm saying.
So when your feet, like my feet, I've noticed, like since I've gotten diabetes, I have to wear socks all the time because my feet get so cold. And I
Yeah.
don't understand why they're so cold. I'm like, why are they so cold?
Yeah.
Is it because of the circulation?
Yes, the diabetes, the nerves affects your circulation and the other types of nerve receptors. So your feet kind of sometimes get very cold, or if you're for example, if you're a smoker, then that makes it even more colder because it causes a narrowing of the arteries. And especially diabetics, their nerves don't really work really well, so their feet get dried more. So you're high risk of getting a fissure, sore, dry, cracked skin that could cause an ulcer. So lotion is very important on your feet every day, especially in the winter, low humidity months, because your feet really dry out. So I always tell patients use a Vino body wash and use a good moisturizing lotion, nothing like Vaseline or anything like that. And in the wintertime, I always morning and night, and not between the toes, so you don't get too much moisture and infection. But the top and bottom, let it dry before you walk so you don't slip or fall. So, but lotion in the winter time, summertime not as important because humidity is high and it's very, not necessary. But winter, fall, low humidity months very important with lotion, and any part of your body for that matter. But um, dry skin always leads to future sores and stuff.
I didn't thought about that.
Yeah.
So like cracking or
Yes,
more
yes.
shape.
We get a lot of patients with like dry, cracked heels, and
Yeah.
those fissures get so deep and they get so tender. Sometimes they get infected, sometimes they get sore. So, the more you could keep it moisturized and healthy and keep the balance in the skin, the better off your feet will be and the less risk of it breaking down. Because your skin's the barrier to the inside of your body, biggest organ in the body, your skin. So, if we could keep that healthy, the diabetic sacs golden. That goes a long way of protecting, because your feet are basically the pillars of your body. Basically good tires. So you want to make sure you take care of them really well, and um, exercise is very important too. With diabetics with their neuropathy and high blood sugars, it makes muscles kind of get weaker. So your ligaments and tendons in your foot and ankle don't work really well. So you're more prone to getting flat foot, achy, tired feet, high risk of getting like deformities like crooked hammer toes or bunions. So all those things happen in diabetics. We see it all the time. So it's very important, kind of like keep your exercise routine also. So keep your muscles strong, So because you don't want your muscles wasted, because it's hard to gain your strength back. And then gait issues happen when your muscles and tendons, ligaments get weak, or older patients are high risk of falls and stuff. And then you get fractures and whatnot. So it becomes a really terrible situation. So very important. Take care of your nerves, vessels, and muscles.
Is there like a key time frame as far as like addressing diabetic shoes or the socks that is better than like a new diabetic diagnosed within the last couple of years versus someone who's been diabetic for a while? When do you start to like recommend that?
Diabetic socks are recommended for everyone. I think that's a very comfortable thing that you could start implementing. There's different sizes and colors you could get online. They're just really comfortable. This feels like you have a good extra protection, So that socks, I think everybody should wear, but a little bit higher. I always tell patients a little bit above the ankle. You don't want no crew socks unless you got like lymphedema or severe swelling in your legs, but just a little bit above the ankle to give you just gentle compression. Those I always patients always wear these no-show socks and I always tell patients you basically put a tourniquet on your ankles because what it's doing is grasping around the ankles and causing swelling above and below. And what that's doing is not doing any favors except for looks, and it's helping make this. It's making the swelling worse, and it's maybe causing nerve pain because it's pushing on the nerves around your ankles. So I mean, very important.
So are those considered compression socks?
The diabetic socks?
Diabetic socks?
Not necessarily. No, they're just diabetic socks. Yeah.
Added padding,
Yeah.
and then the tops probably aren't tight.
Correct. And they have a little bit like a ridges around the arch to kind of support it. So and like around the toes, a little bit more thicker, just to protect the end of your feet. So yeah, they're really comfortable. I mean, I own a pair too. I wear them sometimes. I like them. What about the shoes? Like these are the Hey Dude ones. Oh, okay, Hey Dudes. So nothing supportive about Hey Dudes. Yeah, they hurt my feet bad. They're cute, yeah, but they do. I've got see her little tennis shoes that something like that. Yeah, like Skechers. Yeah, and they are wonderful. But like sometimes the tops of my feet hurt. Yeah. Is that normal? Is it because I don't think they're? It's probably because not having good support. But let me just address her question about the shoes. It depends on the patient. Like if they're newly diagnosed and they have a severe wicked bunion deformity or crooked toes, or if they have like a flat foot, then I really think diabetic shoes right away would be a good idea. Most insurance cover it. Medicaid for sure covers diabetic shoes if they qualify based on foot deformities. Medicare also if you're at the retirement age. Private insurance are hit and miss depending on your deductible and all that, but uh, they're really going to be really comfortable if you have those kind of foot deformities to prevent those future sores and irritations. Um, I just think they're just diabetic shoes are priceless. We've seen a lot of patients prevented ulcers and amputations from just wearing diabetic shoes, and studies have shown that it does prevent, and it's just a good tool to have. And they come in different styles. They're not Frankenstein shoes like everything. No, diabetic shoes are Frankenstein. If you like, we have a shoe rack in our lobby. There's Mary Jane's. There's athletic shoes. Some are younger patients that work in their 40s and 50s. They have work boots. We have tennis shoes, easy to wear. They zip tie, so you don't have to worry about. Older patients, we have Velcro. So I mean, there's a lot of good styles. They've come a long way, and you can't even tell that they're diabetic shoes. That's how good they are. And they come with the insert, multi-density soft insert. They come with 3 pairs, so they heat more to your foot. So you feel like you're walking on a cloud. So that's also another good benefit about diabetic shoes. You have it inserted there already with it, so you don't have to worry about putting Dr. Scholl's or anything like that in there. But to your question, non-diabetic shoes, there are good ones and bad shoes. I personally like Adidas, like what I wear, or like New Balance, because the reason is this mesh that gives, it won't squeeze your forefoot, the toe area of your foot, and plus they're deeper, so they hold inserts better. The Skechers, I always call them shady Skechers because they just don't provide the comfort or support that any good shoe like this would be. And Nikes are always too narrow. So I mean, once in a while, if you have to wear like a Hey Dudes, is fine, but try to get in the habit of wearing good tennis shoes because you're gonna be walking all day. You just want to have good support. Those are Adidas. Yeah. Thank you. Good shoes are very important. Any Is questions? There a particular like house shoe? Like, would you recommend more of a hard soled house shoe versus a soft soled shoe? There's different types of house shoes. There's diabetic house shoes and non-diabetic house shoes. So there's a difference in those two. Yes, yeah. Diabetic house shoes. There's different ones. We have like in our office. We have like a slip-on open back. Like a really soft on the inside, like camel color on the outside. They come in different colors. And then we have back or closed back ones too, so you can just wear them to keep your feet warm. But if you don't want the diabetic house shoes, like I said, I recommend like UFO's women's or men's slides. They're super soft sandals. They have an arch support built in, so they're comfortable. Those kind of things. You don't have to wear like Adidas or anything like that in the house. My feet will kind of get hot if I wear them all day long. So in the house, last thing you want to do is wear claustrophobic shoes. But something protecting is better than nothing.
I'm looking for a foot doctor because I
have neuropathy, and it's
Yeah.
at a level where
It's bothering your daily activities.
my feet burn, and I'm walking funny now because my feet hurt.
Yeah.
And at nighttime when I'm trying to sleep, they're really,
It's hard to sleep.
yeah, it's in high gear.
Have you been to a foot doctor before?
No.
Okay.
And I have asked my primary care and my diabetes doctor for a recommendation, and I'm still in idle mode. So, do you accept new patients?
Yeah, I'll give you my card too. I think you came in late, so I didn't give these other two papers. But a lot of patients don't understand that if you have like a private insurance or any, you really don't need a referral to come see me.
I thought I did.
The only time you need a referral is if you have an HMO that requires a PCP referral to specialist.
No, but all my other times,
Yeah.
they schedule appointments
Yes.
for me. They
Yes.
pick who
Yes.
I'm
Yes.
going to.
Yes.
I've just been
Yes.
waiting.
Patients are all like it still hasn't changed. The culture. Patients are used to having been referred by a primary care doctor to these specialists, and you really don't need it. You control your destiny and who you want to go see and how comfortable you are. You don't have to follow what the PCP says. You do your own homework, research on Google, see who's closer to you, read the reviews, be comfortable, and then make that decision. Nobody should force you anywhere unless they're out of network or your insurance requires it. So that's what I always tell patients. You control your. Here, I'll give you this if you ever need.
Do you recommend, because obviously it's nerve damaged nerves, do you recommend gabapentin or anything like that?
Yeah, there's a lot of medicines for that. Yeah, on that treatment neuropathy, there's a lot of things we can do. Depending on what other medication you're taking, so there's no contraindication or drug allergies. There's oral gabapentin, there's Lyrica, Cymbalta, which are the oral meds for neuropathy. Some patients are already taking other pain medicines or they're taking other like 12, 15 medications. I always tell patients, way too many medications. I think primary care doctors are overprescribing for a lot of stuff. And on that note, I always tell patients when I see them as a new patient, when you go see your primary care doctor next time, tell them keep only the medication that keep you alive. Rest of them, just take them off, because you got to understand every medicine has a side effect. I see patients that are on ibuprofen for years and years. I'm like, it's going to ruin your kidneys. You need to just keep the medicines that are critically important. Right. Other things you don't really need. A lot of doctors, primary care, don't reconcile medication with their patients on a regular 6 month or year basis, and they just keep represcribing like a mill. And patients over time, liver failure, kidney failure, and then it's too late. You have to, like I said earlier when you missed it, educated patient is the best patient. You really need to, when you go to any doctor's office, you need to go in with a mindset that you control everything. Don't let the doctors control you unless you don't know, but you really need to ask hard questions. Why am I here? What are you going to do for me? What are the medications am I taking and what are they for, and how long do I need to take them? Those are important questions that a lot of people don't ask, and they just in and out 5 minutes in the primary care doctor's office or any specialist. I mean, it's really sad, and I think that's contributing to our chronic illnesses because the doctors are really comfortable just prescribing and just high by. And I think it needs to kind of slow down and to change the way we practice. Concierge medicine has really changed it, but it's really expensive and it's not for everyone. But I think you guys, you deserve more time with your primary care doctor in terms of going over all that stuff. And back to that neuropathy treatment, we do also have other options like topical creams. And a lot of patients love those. They're like compounded pain creams. They have like 5, 6 different medications in them, which the good thing is there's no systemic toxicity. It wouldn't interact with any blood thinners. There's no like drowsiness like with gabapentin, or feel like you're like don't sleepy all day. So those side effects are gone. And the beauty about the cream is you just rub it on your feet on the top and bottom a couple of times a day. Some patients do it twice, some do 3, some do once. And it really affects, how your neuropathy pain in your feet is. And it's a really powerful cream. We prescribe it all the time on patients that fit that criteria. And I think it's a great benefit. It just really kicked off in popularity the past 5, 6 years. Before, we didn't have that kind of option. But it comes not from CVS or Walgreens. It comes from a special compounding pharmacy. And the beauty is it gets mailed to your house. So you don't have to go nowhere. So that's an option we give to our patients that when we treat, when we discuss neuropathy treatment. I always give the patient the options. What are you comfortable with? I'm not going to force you in any medicine or any direction. You make that decision because ultimately it's your health and it's your feet or ankle and your body, for anything for that matter. Like I don't like to pressure any patient, and I think that's how it should be. Patients should be given all the options and then make an educated decision. I'm just here to assist, and help you guide you. Um, Certain situations, obviously, if it's needed, then I would tell you, we need to do this, we need to do this. But I think patients should ultimately kind of have that kind of empowerment. Does that make sense?
It does. I love your outlook for sure.
Well, thank you.
So can is someone like me that feels feels it
Mhm.
Most of the day and worsens at nighttime? Can can it go away? Can I be cured from neuropathy?
That's a good question. It's a tough question, but let me answer it this way. It all depends on the patient. We had some patients that they do well with the medications, but they have to take it for a while. Some patients, a couple years down the road, they take it and they get better. It all depends on the health of the patient, how good their diabetes is well controlled, how compliant they are, all different health factors. So it's not just like a one factor. So it's like I said, diabetes is multifactorial disease. Everything has to kind of line up, and if it doesn't, then it may not help you get rid of it. But at least if we could at least slow the progression down of the neuropathy, or at least make it comfortable, I think that's a win-win situation. That's fine. But I think
an appointment as soon as possible.
that's fine. We'll take care of you anytime. We also, just a side note about my office. I'm there Monday, Tuesday, Thursday, Friday all day. Wednesday mornings I do surgery at Louisville in the hospital, and then afternoon I go to my U of L building office in Louisville. You know where the new Publix is, old Henry and Gene Snyder? That big U of L building. I have my office there Wednesday afternoon, so anybody in the Louisville area I'd see there. So that kind of keeps me busy. I've been here since 2012. Sorry I didn't introduce myself correctly, but I've been in Shepherdsville since 2012. I used to practice in Louisville. I'm not from here. I'm from Kansas City, Missouri. Go Chiefs. So I know. Yes, yes. You're a Chiefs fan? Oh, good. I'm glad we have a friendly Chiefs fan. It's good to lose against a tough team. It's to kind of start fresh. But at that note, yeah, I'm from Kansas City. Grew up there 44 years. Lived there all my life. Went to University of Missouri Columbia undergrad. Then went to Chicago Medical School. Did my residency in Dayton, Ohio, which is not too far up north. And then I was looking for a practice here, and ended up in Louisville. Practiced there 4 years. Got board certified, and then wanted to kind of, never thought I would open my own practice, but it just, I guess, God's will, and it happened. I never thought I would be here in Shepherdsville. See, I'm not from here, so I didn't know how big everything was. So, and this is a very well community that's very underserved. I'm just so glad that I've been here. It really needs more specialists so it's good that we have people like me and other specialists to take care of patients, because I tell patients, I don't want to drive all the way to Louisville and park in a garage and go see a doctor and wait a couple hours. Our office is so convenient. You park outside, come in. We make it very efficient as possible. We try to have good staff, try to take care of the patient. Like I said, we've been here since 2012. We don't advertise at all. No radio, no newspaper, word of mouth. And that's how I like it. And that's how it should be. Mm-hmm. Our motto is, if you take care of the patient like your family, you don't have to worry about a thing. You don't have to worry about a thing. So that's how it's been, and so far it's been successful, God willing. Hopefully we'll be here another 20 years, then I'll retire. But yeah, we also in our office do like an ingrown toenail procedure. That's the only procedure we do in the office. We treat warts, we see fractures, we see little kids. Like, for example, we had a patient at 4 o'clock today with an ingrown toenail. We took care of it. So we do a lot of different stuff in the office, like ankle or foot injury. I always tell patients, once you know where I'm at, if you ever have an issue over the weekend, or if you have an injury, don't waste your time and money in the ER or immediate care. They're not going to do anything. Just call us. I'll answer the phone. I answer on the weekends. And I'll just tell you, just come on in. We'll take care of you. We work patients in the same day if we need to. So that's the type of thing. We don't like to have patients wait weeks and weeks out, if we can help it. Some days we have a little bit of time off from holiday. Like next week, we're only here Monday, Tuesday. So Wednesday, Thursday, Friday is Thanksgiving. So we're kind of closed. But we try to accommodate as much as we can. And we take all insurances and everything. So, we try to make it as accommodating as possible to the patient. So, we do a lot of good stuff.
What about nail trimming? Do you do that at all?
Yes, we do nail trimming on diabetics and non-diabetics. But very important thing, the insurance only covers it for certain risk factors. If you're like a older senior, like 80-year-old, most likely you have poor circulation. Insurance will cover it every 9 weeks or 62 days for nail trim. We have a lot of older patients that come every 9 weeks. We have also older patients that are diabetic they have poor circulation, they come to get their nails trimmed. But if you're like a little bit younger than that, and if you have diabetes, or if you have a history of an ulcer, or if you had a previous amputation from an ulcer, you're considered high risk. And then insurance should, in theory, knock on wood, cover you get your nails trimmed every 9 weeks. So you have to be like a high risk.
Would heart attacks and bypasses be considered high risk?
Technically, it's hard to say without examining your foot and ankle, because the insurance will look at what's your high risk on your foot and ankle. That's a high risk, which you said, but we would also have to make sure there's other qualifying risk factors that we examine from your foot and ankle, like if you have a history of a callus or a sore, amputation, those kind of things, but we do have patients that come, every few months that don't qualify for all those things, and they just pay out of pocket. They could just get their nails trimmed too if they want to, but that's a whole different discussion.
I usually soak my feet in a warm soapy tub before I cut.
Okay, so it makes it softer to trim.
Yes.
Yes.
I found that my toenails are getting.
Yes. Are they getting thick? Is that fungus?
Why do they do that when you get older?
Well, the thickness could be either due to nail fungus, because diabetics, like I said, they have a weaker immune system, so they're high risk getting nail fungus or warts or athlete's foot, that kind of stuff. And once you get nail fungus, depending on how severe it is, it can be hard to get rid of, especially in the older diabetic population. But there is treatment for nail fungus. There's topicals that we prescribe. There's oral medications. There's a lot of things we could do for nail fungus. But to get to your question, that when you soak it, the nails more pliable and more easier to trim. Make sure you trim it straight across and don't clip it too short, because then you could get an infection too.
Well, I've noticed under my left foot, big toe, I had to take it like one of the brushes and it's
to get some of that debris underneath the nail.
It's not really debris, but it's chunky skin.
Chunky skin.
Like chunky.
Okay.
White, thick skin.
It could be just part of the nail fungus too.
That's there. So if I do make an appointment to come to see you, like I usually keep my toes aren't cute, but I try putting polish on them to make them cuter.
Yeah.
So should I take the?
Yeah. So at least we can see what the nails look like. Sometimes patients come in, I have nail fungus. I'm like, I can't see, ma'am, through your nail polish. So it's very important. Yeah. Very important. And besides for clipping the nails, don't soak your feet every day. There's no need for it. You'll dry the skin out too much.
I just do it for
just clipping them. That's good. Like I was telling the ladies there, make sure you check the water temperature of the hands before you jump in the shower, because if you got neuropathy, you cannot tell. Yeah. So those are very important things. Any questions so far? I mean, I could talk all day. There's a lot of things that we could talk about, but shoes, socks, and all those things.
I'm gonna want all that.
There's also
help me make my deductible.
Yes. Yes. Do you guys have like questions about like anything else we do in our office? Or?
So you specialize in diabetes. Because you're speaking about it. You're here. Okay.
We specialize in the foot and ankle, diabetic or non-diabetic. Okay. But I just wanted to give a talk about.
I want to make sure.
Yeah, absolutely.
That if I come to you, you have an understanding. If I say, "Here's what's going on," you've heard those.
Oh, absolutely. Half of our patients all day are diabetics. Okay. So we see them for different reasons, like ulcers or fractures or whatever. We take care of it. But
foot care is very important, because my husband's grandpa started out losing toes.
Yes.
Then it went up to
yes.
He got up both ankles.
Above the knee.
He was basically just sitting on his trunk. On both legs going. He was 90-something years old.
Wow.
Blind.
Once you lose one amputation, like above or below the knee, 5-year mortality rate goes up. So I mean, one amputation can always lead to another amputation. So it's very important we don't get one in the first place. But some patients just don't listen. I have patients all the time that come in and they're diabetic and they have a diabetic sore. I'm like, how long has it been there, sir? Oh, it's been there a couple of weeks. I'm like, why'd you wait this long? And they just don't understand the severity of it. And I'm like, well, can you quit smoking? No, I can't do that. I mean, like, there's only so much we can do, right? Wow. I mean, if you can't take control of your health and do something for yourself, you're basically not doing yourself any favors. And only so much I can do unless I take you home with me and take care of you. But sometimes patients don't listen, and you have to, follow. It's very important. Like I was telling the other ladies before I came here, diabetes is worse than cancer. It affects every single cell in your body. And it's a very, very, very devastating disease, and it's going up in the population. Where I'm from, India, almost 1 billion population, diabetes is also skyrocketing there because more middle class people eating more on junk food and unhealthy food, so it goes up. And more technology, the more obese we get, so a lot of things, that we have are making our lives worse. So I mean, it's just, and I think the government should do more outreach or more things to change, because otherwise it's going to get worse. And most of the time, everybody's diabetic, and in the future, everybody's going to be more diabetic. And we already people are pre-diabetic or diabetic and not even diagnosed yet. So there's a lot of those patients out there in the population. So it's going to come to a point where half this country is going to be diabetic. I mean, it's just a matter of when. And
well, and too, there's a lot of people taking diabetic medicines for losing weight.
True.
And then people who are diabetic
Mhm.
get it.
Yeah, true. And it's just, people just don't make good food decisions, and it's just really hard to do, especially when the economy is not good. It's just hard to, I understand all that, so but it's a catch-22. Like you're stuck, and the government's not there to help. But I mean, that's why we're here to kind of help you, kind of guide you and educate you on, kind of be aware of stuff.
I appreciate you doing these workshops.
Well, I was telling her I wish I could come every quarter or monthly or whatever.
Well, I've got down to the note.
Oh, good. I mean, and we could focus in the future on specific more topics, and I could even demonstrate, make a diabetic show and show you what does it look like or whatnot, or yes, yes, yeah,
well,
we could
there's only so much you can Google
exactly,
and research
And then
online.
rely on it being accurate.
exactly.
And I was considered pre-diabetic in like 2015, and I didn't know what that meant.
Yeah.
So it really meant nothing to me because I didn't know. I was just told that
Exactly.
and left.
Yeah.
And then in 2020, I had a heart attack, and they said I was full blown diabetic. And I went home from that hospital with insulin and metformin, and it just
and then
things.
Yeah.
I have been considered uncontrolled sugar since then.
Wow.
And I'm just now figuring it out.
Yeah.
And I'm on purpose. Like I feel like I'm on a mission. I was Googling stuff on Facebook and Google. And I came across these workshops.
Yes.
By coincidence.
Yeah.
Well, I mean, they're out there.
Yes.
But I didn't know about
exactly.
it. And so I appreciate it because, I'm unfortunately at the point of I have to know more. Yeah, you have to be educated. Like I was telling the two ladies, the best patient is the educated patient. Because if you go to the doctor's office and if you're not educated what's going on, then it's not going to go through your head. You're not going to follow it, and it's just waste of time and more complications. So I was told that my heart condition is because of diabetes.
Yeah, absolutely.
Wow.
Absolutely.
Destroyed my heart.
Absolutely. Absolutely. Do you guys ever ask your primary care doctor what your A1C is? Okay, good.
I've always been high.
Okay.
When I was educate you, I didn't realize it was so serious because nobody acted like it. It was just like, oh, you're diabetic, do this.
Yeah. Here's metformin and see you in a year.
Yeah.
But it's more than.
Back to what you were saying before about throwing medicines at people and send them on their way.
Exactly. It's just terrible. But
I've they send you home. Oh, you can continue to eat what you're already eating, just portion control. Well, when you're in a habit of eating the same foods, you don't know what else to eat.
Exactly.
And I didn't know I was a picky eater. I'm a picky eater.
Me too.
And I like my cereal, and I like my mashed potatoes, and my baked potatoes, and my French fries, and my pizza, and my macaroni and cheese, and fettuccine.
Yeah.
So when they told me you need to stop eating all that, then I'm crying like, what do I eat then? So this is why workshops like this need to be done.
Yeah.
Because I have been clueless.
Yeah.
And the support
being
helps.
clueless got me in trouble.
Yeah. And I always tell patients after you eat or dinner or lunch, walk and exercise. Don't sit after you eat because that raises your blood sugars. You want to burn it off and kind of get your metabolism going. Because the last thing you want to do is eat and then go on and watch CNN for a couple hours. And that's just not doing your body any good. If you could, I always tell patients if they're not severely diabetic, eat if you like, but burn it off. Just don't store it. Because if you don't exercise off of it, you'll just store it as fat, and it'll raise your blood sugars and insulin resistance. So you want to make sure what you eat, burn it off.
Now, see, before, if someone had told me that, it wouldn't have sunk in. And I've had to go through twice now cardiac rehab. I'm getting ready to start it again. And before you exercise, they take your blood pressure, and you have to take your sugar level,
yes,
glucose.
Yes.
And working out an hour, like you can go in at 259, work out an hour, and then check your glucose. You're like at 119. And I wouldn't have been a believer to that if I hadn't experienced it myself. So unfortunately, I had to get there.
Yeah, exactly.
The wrong way, but it works. Walking works.
Yes. Is anybody just
that, like
yes,
X-ray,
yes,
people don't believe
yes,
or how serious the fracture is until they see it. So I mean, it makes sense that
you can make that connection. Like I was telling them, like if I have a patient with a fracture, and on the first visit of the new patient, they come with a fracture, and I show them on the X-ray, this is where your foot's broken, and if you do X, Y, and Z, we'll get it better. But if they don't see that on the X-ray where it's broken, they'll be like, oh, nothing, no big deal. I'll just walk it off and it'll be fine. So that makes the big deal when the doctor spends time and kind of shows them exactly. I think seeing that is very important, especially you have the technology. Why don't you use it to your advantage? Patients, you can see through your body. We also have ultrasound too, but that's for like heel pain and stuff. But a side note, does anybody else have high blood pressure?
I do.
Okay. Do you guys check your blood pressure every day?
I do now.
How do you check it?
Just
what time of the day?
Years later, I just bought me a new machine from Walmart.
What time of the day do you check it?
I've been told to check it first thing when I wake up, but try to be consistent within my time frame. I'm not really good at it doing that just yet, but I'm doing it.
Do you record it anywhere?
It
on your smartphone.
It goes to my iPhone.
Yeah, so there's a lot of good devices out there that connect with your smartphone. Yeah. I always tell patients, not that I treat hypertension, but it's very important to check your blood pressure at night before you go to bed. Take your blood pressure in your smartphone and just sit on the sofa, sit down for 10 minutes, turn all the TV and distractions off, put the blood pressure cuff on, wait 10 minutes, just relax, put your mind to ease, and just make sure your arm is positioned level, and then check your blood pressure. And then you'll notice a big difference in what it is. Patients, I always tell them, are you have high blood pressure? No, I don't have it. I'm like, you take a blood pressure medicine. Yeah, I have blood pressure. Then without the medicine, of course you can have high blood pressure. So you want to make sure, salt is your silent killer along with sugar. Just try to, 99% of processed food has salt already added in. So just kind of use Mrs. Dash instead. Get rid of the salt. Get the salt. In plain language, I'll explain to you what salt does to your body. It keeps the water with it in your body. And your body's a closed loop, like a garden hose. So all that water is going to keep going in your arteries, and it's going to expand and raise your blood pressure. And that puts a stress on the kidney, stress on the heart, liver, and all your organs to a certain degree. So you want to make sure that blood pressure is under control so the risk of stroke and heart disease goes down. And that's also kind of in conjunction with diabetes, So the exercise, like I said before, is very important for both those things. So, if you're going to control your diabetes real well, might as well control your blood pressure too, because one of them is going to, be really seriously out of control, and it's going to affect the other.
See, now that I'm like focused, my sugar level keeps dropping. So now I'm fighting to bring it back up. And in the middle of the night,
do you use any type of app on your phone to see what food that's good for you to eat?
I'm doing it. I'm in the green level.
Oh,
now.
good.
I'm not in the.
And you see an endocrinologist?
Yeah, okay. I see Dr. Laura Facunli.
Facunli, I know her very well. I know Dr. Facunli. She's still downtown? Yes.
Well,
she used one of her office. Okay, good.
Breckenridge.
Yeah. I always tell patients, yeah. Oh, is she? Good.
Yeah, and I'll be here too.
Good.
So my blood pressure has dropped all of a sudden too. That's why, because I'm getting dizzy and lightheaded. I'm getting up and grabbing a hold of
yeah,
because I feel like I'm gonna just fall.
Do you think your blood pressure medicine needs to be adjusted then?
They've cut it in half now. So, and I take two.
Lisinopril.
Yeah, and Metoprolol.
Metoprolol.
Yes.
Yeah.
So they've cut both of
Gotcha.
those. Well, one was already in half 2 times a day. The one that starts with an M. Now, so we're in that adjusting.
Okay, good.
Now I'm getting ready to have to adjust my insulin and my metformin because I'm dropping into in the 52, 57, 63.
You don't want to go too low. Yeah.
And my reader saying hi.
Yeah. Make sure your primary care doctor knows what your blood pressure readings are. Record them on a paper somewhere and show it to them next time. But I always tell patients, like, if your diabetes is not getting managed well by your primary care doctor, sometimes they're so busy, go to an endocrinologist. I mean, there's nothing wrong or shameful going to an endocrinologist. They're the doctors that specialize in diabetes and other endocrine like thyroid or whatnot, which may be also out of control. But go there and see what they have to say. And if they have anything different to say, it's worthwhile. It's your own body, But just take advantage of it. See the specialist, like foot and ankle. Come see us. So, use all your specialists to your advantage. That's what your insurance is for. You don't just want to let your primary care doctor keep managing if it's not getting better. If it's better, fine, let the primary care do it. But if it's not, then you should really not waste time and go see a specialist. That's for anything.
I have one question.
Yeah.
So kind of tying back in between exercise and diabetes, and obviously taking care of your feet and diabetic shoes and such. So high impact versus low impact versus long distance walking. What are your recommendations for what are good amounts of exercise without causing any damage
to your body and your feet? I guess that could also, it depends on the patient, obviously. If they're like a middle-aged working, then it's hard to do aggressive exercise. Depends on like if you're morbidly obese or high obese. I always tell patients, if you haven't done exercise before, don't just be a weekend warrior and jump right in, because you're going to cause more problems with your feet, especially maybe stress fractures or pain or other things or sores. So just gradually kind of increase it. I would say like 3 times a week, for 30 minutes is good exercise to start off with. Maybe just do like a treadmill with no incline, like a low speed, and just kind of build up your confidence in your muscles to get used to having somebody all this exercise. Because if you have an exercise and you go all at once, muscles, ligaments, tendons are not used to it. They'll be like, you're gonna get severe cramps. You may get, like I said, stress fracture, foot pain. Your other body joints may hurt. You may cause more damage. So you don't want to go all at once. Slowly, kind of get in the game. And a yoga's fine, or like just don't be going on like a elliptical and go on a stationary bicycle, or if you have a dog, perfect reason to go outside and take him for a walk. That's a good way to have taking care of the dog's health and your health at the same time. 30 minutes exercise is good. And then when you become more comfortable and your body's used to it, then you can do 30 minutes every day. 30 minutes a day is what we're asking for. It's not a lot of time. Most people, you spend 2-3 hours on Instagram or TikTok on the phone versus 30 minutes on the exercise. So you could even watch your phone if you're on the treadmill and do both things at the same time. But you got to invest in yourself. I mean, it's a luxury car in your body. If you don't take care of it, it'll break down. And sometimes you end up in the hospital and you don't want that. So just never too late to turn the ship around and take care of yourself. Very important. Nobody will do it for you, by the way. You have to be your own own captain. And I know it's not like it's a long-term commitment. Sometimes we go off course. We all do. We get busy. Some things happen, but just try to keep a mental or physical schedule. Like if you're retired, there's no excuse. And if you're working, you're working. You're tired at the end of the day. Then use the weekend to your advantage. Like find time in the weekend exercise. Do that. But there's always, if there's a will, there's a way. But maybe have a friend or somebody to exercise with you, so that way you're motivated to go. If you're by yourself, you're like, oh, it's too cold. I'm not going in the winter. But if in the house, if you have that equipment, you could do that too. There's a lot of different ways to do the stuff.
So I use the app that's my chart. I use my chart.
Yes.
So, and my doctors, like I said, Fakunli is my doctor. My cardiologist also knows her. So
they communicate through my chart. Yeah.
So they talk or send messages so that they can, so my cardiologist can inform her where I'm at and what's going on. Do you also use my chart?
We unfortunately don't use my chart, but we have a different EMR system. But if we need to communicate with any of your primary care specialists, we could do that in a heartbeat, either by phone, fax, or
if I see you, you can send it.
Oh, absolutely, absolutely, yeah, absolutely.
It just
That's very important. Yeah,
tell them stuff, and then I'll go home and like, oh
yeah,
man, I forgot to
yeah,
tell them I was
yes,
dizzy
yes,
today and lightheaded. So I had to wait till I go
yes,
to the
yes.
next doctor.
And sometimes when you're at the doctor's office, you forget everything you had to say. So prepare yourself the day before the appointment,
Yeah,
or write memos down on the phone or a piece of paper and take it with the doctor. What questions you have or what concern, and that way. And a lot of patients come in my office. They, as a new patient, they're diabetic or whatnot. They don't know what medications they're taking. I'm like, how am I supposed to prescribe you something if I don't know what you're taking? If you're not sure, write it down or to have somebody, family member, type it up, or bring the bag in a Kroger and I'll write it in my computer. But at least we need to know what you're taking.
It's under my chart.
Yeah,
they do have
yeah.
that.
And some tech savvy patients, they have that iPhone and they could put all their medications on that health app on their phone, and that has all that information too. So you want to make sure all your doctors know what you're taking, and always very important to have a typed up medication list, allergy list, and past medical history if it's not too complex, in a purse or a wallet. Main reason is just in case something happened, you were unconscious or in an accident, EMS needs to know what you're taking, or the ER, so they don't accidentally prescribe you something that may potentially be fatal or cause a lot of problems. That's like your life passport. Everybody should have it, I think. Right now, iPhones have it, but like if you're unconscious, you're not going to be able to access your phone. So it's always good to have a physical piece of paper somewhere handy.
Well, I went to the hospital with my mom this weekend. She fell, and they were asking her all these questions. Mm-hmm. I had no clue what any of her medicines.
Yeah,
were.
yeah.
And they wanted to do a CT with contrast.
Yeah.
She said, I can't have contrast.
Exactly.
Because of her kidneys.
Yes. And that's very important. Like if you have an elderly patient, like you just said, that's diabetic, or if you take care of them, make sure, because older patients sometimes, they may have a little dementia or they may not sure. Make sure you're responsible enough to fill their pill box. If they live with you, that's perfect. Like my parents live with me and I fill their pill box. But if they don't live with you, please at least once a week go there, see where their medications are, check if they need refills, fill their pill box, because you don't want them to overdose or skip a dose. It could be really dangerous. And sometimes the seniors, they forget, or like, oh, I forgot. Oh, no big deal. I'll just take it tomorrow or whatever. Yeah. But they need to have somebody to watch over them like a hawk. And I think that's where the kids should do for their parents or any grandparents or whoever. I think somebody needs to there should be a dedicated person for that kind of stuff. Very important. So I mean, it's a lot of work, but prevention, like I said, is so much better, because once you're in the hospital, hospital is not the friendliest place, and once you're in there for a serious problem, who knows what's gonna happen, right? I mean, you go in with one thing, I have patients come in with one thing, they come out with another thing. So I mean, very important.
I just learned that I was on Plavix, or the generic.
Yes,
Plavix,
yes.
And since 2020, and a cardiologist just did it because there were some complications that I just recently went through, and she said, I'm going to test you. I want blood work drawn to see if Plavix even working. It wasn't. Oh wow! So I've been taking Plavix since 2020.
Dang.
And thinking that I'm on blood thinner, and it was doing nothing for me. So I just now
realized.
Well, my cardiologist did, because I was still hurting and having issues, and so I didn't know that you can have blood work drawn to find out if medicine is working on you.
Absolutely, yeah.
So just that's a side note for anybody.
Like I was telling, I don't know if you heard me earlier. Every time you go to your primary care doctors or any specialist, ask them which medication do I need to continue. Why am I taking it? Is it working or not? And take them off if I don't need them. I mean, the less medicine, the better. The more medicine. I have a patient on 20, 15 medicines a day. You know how many medicines that is for your body to metabolize it? What if there's cross interaction stuff? We overprescribe this country too much. We need to go back to the homeopathic ways. Because it's easy to write a prescription and get the patient out the door, but it's not the right way. I mean, really, patient need to, like I said, education is very important. You have to ask those questions about why you're taking it.
On my taking my blood pressure, they told me to sit at my kitchen table with my arm relaxed and my feet flat on the floor, and I would cross,
Yes.
relax,
Yeah. And that can make a big difference. That can fluctuate the reading too. Yeah.
So see, workshops or talking to someone.
Yeah. How to properly. Yeah.
Helps.
I always
I wouldn't have known how to.
And instead of dangling your feet, get an ottoman and put your feet straight.
Okay.
And then just rest like on a side sofa, rest your left arm, put the cuff on there, and then wait 10 minutes, relax yourself, and then check the meter.
Okay.
And you'll notice a difference, a big difference.
Good.
But a lot of good questions. Anything else we could talk about? I don't have time. No worries.
Any good foods you suggest that are like good for foot health or promote good circulation in the feet? Anything that you recommend like that? I mean,
like food.
I
I have some patients that swear by cinnamon to help with the neuropathy. So cinnamon. So I'm like, if it's working for you, take it. It's not going to cause any problems, But there's no one magic food, to kind of help you with anything like neuropathy or anything like that. But
there's Facebook groups for diabetes, and their comments are they suggest. I don't remember the word what it's called, but cinnamon is the main ingredient.
Do you all take a multivitamin, if I may ask, or?
I take a vitamin D.
Oh, would it hurt to take like a once a day woman's either a silver or like a regular adult? It has some important nutrients that you don't get in your nutrition, like B vitamins, which are important for nerve health and neuropathy patients, and other nutrients, that might be important to take. There's no reason why not. And also on the note, I forgot to say, with this, flu season just started, right? So I always tell patients, non-diabetics and diabetics, but especially diabetics, your immune system is weak. You should get a flu shot every year. And I always tell patients, and I bugged them to death, you need to start taking the first week of October. They're like, oh, I'm going to go to my primary care doctor and get the flu shot. I'm like, no. Go to Walgreens or CVS. It's much faster. You won't have to pay a nickel out of your dime. And it'll be quicker. And the primary care doctor will get the record anyway. Why are you waiting for December or November to get a flu shot at your primary care doctor's office when they're already busy? Let them relax. Go to the pharmacy and get it done. And I always tell patients, if you're going to get, the reason they take them early in October, because flu season in November, it takes 3 to 4 weeks for your immune system to prime up and attack the flu virus if you do get it. So you really want to have your best optimum protection and get a heads up. September is a little bit too early, but I think October, the first week, is a good time to take it. So it gives your immune system enough time to build up the antibodies and all that stuff. So if you get a flu, you'll shake it off.
How do those work if you don't have a spleen?
That's a good question. That's something I really don't have much experience in. That's something you might have to talk to like a immunologist. Pharmacists technically could, but may not. Maybe your primary care doctor, or if you look at an immunologist or something, that would be a good question to ask too. And COVID vaccine, I know a lot of people don't take it, but if you had COVID before and you had a lot of problems, it doesn't hurt to get the vaccine booster. It'll save your life. It'll prevent you. But the vaccine?
No.
Okay, COVID. Yeah, right. So, but don't take COVID and flu shots together, because when you go to the pharmacy, the pharmacist's like, oh, you're due for pneumonia, COVID, flu. Let's all get that done today, Ms. Smith. And I always tell patients, please don't let the pharmacist talk you into it. There's no rush. Take the flu shot first. Wait 2 weeks, then get the COVID booster, and then wait 2 weeks and get the pneumonia shot. Why are you taking all these injections at the same time? Pharmacy wants to get it done because obviously they have some type of incentive, or who knows. But I just don't feel like, I wouldn't feel comfortable to getting it all at once, because what if you have a reaction and you won't know what caused it? So very important. And why are you confusing your immune system? Just give it a break. So just space out. Just space it out.
We see quite a few people in urgent care that would have multiples done together, and then they just, if they had any.
Yeah, exactly. And they get sick as a dog, and then they get, next year, like, oh, I'm not getting no shots or flu shot because I got sick last time.
Right.
There's a reason. There's a reason. So.
Good suggestion. Very informative.
Oh, good.
I'm trying to think if there's anything else. I know. So you mentioned like calluses.
Yes.
Can you dive in a little bit more as to what makes them so risky versus like an ulcer? What's the difference there?
So callus is basically thickening of the skin from repetitive pressure. Your body, like I said, the skin is the largest one in your body. So whenever you walking and you get a callus, that's the sign that the body is trying to protect itself from certain things. Like a callus doesn't happen for a reason. Like non-diabetics, calluses happen because there's a bony prominence. That's the bone is pushing too hard, or patients biomechanically not walking normal, so that forms a callus because the skin is trying to protect the bone underneath by thickening up and protecting it. But if in a diabetic, if you have neuropathy, your skin is gonna thicken up to protect it from breaking down. Does that make sense? So we call that a pre-ulcerative callus. So if a patient is diabetic, has neuropathy, and they have a callus, and if there's like little red dots in it or like a little bit of bleeding underneath it, you probably got subdermal bleeding because the skin is almost about to break down and become a sore. So the body is trying to protect itself from getting an ulcer, but that's a warning sign they should go see a specialist right away and get it evaluated, because lo and behold, anytime we see a patient with a callus with a little bit of like blood underneath it, it's gonna become a full-blown ulcer. So and calluses, like I said, they could be due, and diabetics due to like how they walk, pressure points, neuropathy, foreign body. A lot of things can happen. I had a patient who was completely neuropathic, had shoes on, stepped through a rusty screw or nail, and it went through his shoe. Didn't pay much attention to it. Had to admit to the hospital. Saved his foot, but he had to go through all the hospitalization, surgery to clean it up and everything. So very time consuming for the patient and expensive healthcare for the country. I mean, prevention can save a lot of money and time and hassle and heartache. So I mean, you know.
That calluses, that made me think, what causes calluses at the end of your
toes?
your little toes, right at the nail?
Okay.
You could sit and,
yes.
like after you shower or bathe, you could sit and scrape it. And it's a callus.
Yeah.
It's hard like a callus before.
It could be from ill-fitting shoes causing repeated micro trauma against the shoe, or if you have a little bit of crooked toe rubbing against the end of the shoe. There has to be a reason. I mean, x-rays would show that too, a clinical exam would, but there's a reason why that's happening.
Yeah,
so
it didn't used to happen.
Yeah, and like I said, your foot could be normal a year or two ago, but with diabetes over time, like I said, your ligaments, tendons get weak, muscles get weak, so your foot starts changing, and you don't really recognize it because you see your foot every day and you're like, oh, I don't see anything. But when you have an outsider or a specialist look at your feet, they could recognize it right away,
Yeah, I need one of your cards too.
Oh, did I give you one? Oh, sorry.
I got one.
Well, I brought plenty. You could pass them to other friends or anybody that needs our services.
And then, so we got about 10 more minutes.
Yes.
I don't want to keep you over your time, but what would be your first aid? Let's say something like that happens, or you're at home and you stub your toe and you do get an injury, it's bleeding, something like that, and it's on the weekend. What kind of first aid do you recommend until you can get in?
To a specialist or a provider? Betadine is a really good antiseptic, antibacterial solution. Everybody should keep in their cupboards. You guys know what betadine is? It's like an iodine type of, stuff really does not come off your clothes if you stain it. But it's really relatively cheap. It works really good. We use it a lot of times for our wound ulcers and stuff. It keeps the area antiseptic, dry, and antibacterial.
Doesn't it burn?
It depends if you got a deep gashing wound or something, it can burn. But if you, like she said, if you have like a toenail injury, or if you stubbed your foot, or if you have an open sore or something, or just put some betadine and wrap it up with a dressing on it until you can get to a doctor's office to have them check it out. Because the last thing you want is to not dress it up and keep it open to the environment with there's a lot of germs everywhere. And on that note, also keep it bone dry in the shower until you see a specialist. The patient's like, well, why do I have to keep it dry? Very important, because when you take a bath, all the germs on your body are going to go down to your feet and settle down in the shower. And that's a really big opening for infection to kick in. So you got to keep that bone dry either through like a garbage bag, like a Kroger bag or something, or a saran wrap or something. Just keep it dry until you can see the doctor and make sure if you need antibiotics or not, or further local wound care, right? So yeah, that's very important.
Now, when you mentioned dressing, with like a triple antibiotic, without.
I wouldn't use triple antibiotic. Betadine is probably better, but triple antibiotic will just, if you patient don't know how much to put in the first place, and triple antibiotic always kind of makes the moisture increased on a wound or anything. So you see how you have a band-aid, like sometimes you put Neosporin, it turns white, that skin becomes macerated, and then last thing you want on a neuropathic foot is macerated skin that's going to break down further. You want to keep everything dry as much as possible. So a healthy individual, Neosporin, not a big deal, but in diabetics, I really don't like it. Betadine keeps it more drier and antiseptic better.
And then, are you on the no peroxide? I know that's kind of become a new thing, is not really recommending peroxide after like the first initial injury.
I really don't a big fan of peroxide. If you have like a wound that's like a little bit dirty, or if you want to cleanse it, go with the pharmacy over the counter. They have sterile saline sprays. They're wound sprays basically. It's a canister that has like a pressure in it, and it contains clean water, saline basically. It's bacterial, antibacterial. It has no bacteria and it's clean. So you could wrench your foot and clean out that wound or any type of injury and get off any debris, and then put the dressing on. So that way you know for sure all the germs are kind of washed away. And peroxide is just going to cause more bubbling and causticness, but I like the saline better.
And then again, I'm assuming since you're talking about diabetic soft, you don't want to do like hard, like ACE bandage, super hard compression. Make sure it's a looser.
Yes, because if a patient has a lot of swelling or if they can't feel, a tight dressing could be just as a worse nightmare because you could get some more, you could cut off circulation or you could, cause more infection to stay in that area. So you just want to make a gentle dressing that doesn't come off but doesn't cause any constriction. So that's very important. A strap is good to put on because that could elastic and you can always control it if you need to. But you don't want to put like, really tight. Do you guys know what Coban is, like a dressing? Coban is like a flexible dressing that we use for surgery patients stuff. But that's yes, best things since sliced bread in my book. But it comes in different colors, which is kind of cute. But we use it all the time for after our nail surgery, we dress it on the toe, or after foot surgery, we put on the foot or ankle, or ulcer care, we put on it as a elasticity to it. That's something you get at Amazon or if any pharmacy has that too.
And non-adherent versus
yes, non-adherent. You could put a non-adherent on it if it's if you feel like it's gonna be sticky. But if you put a regular gauze, the next day before you take the dressing off, while you're taking the dressing off, put that saline spray on it so it kind of gently peels off so it doesn't damage the healthy skin.
Oh wow.
Very important. And what else I was gonna say? I forgot my chain of thought on that.
Sorry. I just know that's always a big one.
Yes.
We would run into things like that.
What else? Yeah, on the weekends, like you could always, just like do that things on the Monday morning. Call the doctor's office, primary care specialist, whatever, and just gotta make sure you get seen. Don't wait longer because the more you wait, the worse chances are. And it can become worse situation. Patients like, oh, I'll just do this for a couple of days and see if it gets better. Like, and diabetic, don't wait. Just get it taken care of. You'll feel better, peace of mind, and that way at least so that way it's taken care of.
I'll probably be coming to you.
That's fine. Like I said, we've been here since 2012, and we see a lot of diabetics. And
I didn't know that the podiatrists had shoes in their office.
Yeah.
I thought you'd have to order them or something.
Well, a lot of podiatrists used to do it, but it's just Medicare is making such a headache of how to do shoes and stuff. So a lot of people just giving up. But we still do it enough, thank God. But there's a process involved. It's not just you come in and get shoes. Insurance requires, for us to do a diabetic foot exam, document that in the computer, and then if you qualify, give you a order form or prescription for diabetic shoes, and then your primary care doctor has to sign off on that order, and then you got to come back to my office with the last chart from your primary care doctor and measure you for diabetic shoes, pick them out, order them, and then dispense them. So it's a process, a 3-step process, not something you come in quickly and get shoes.
So if you can't get them through insurance, approximately how much an estimate?
Approximately, boots are a little bit more expensive than regular shoes, but like regular shoes, like $225. But they're good quality shoes. They come with a pair of inserts. It's a good investment.
Those one shoes that everybody's starting to wear starts with a K, Kona or something. Or
I'm not sure.
The new tennis shoes.
Yes. What are they?
Koa, maybe?
Oh, am I saying
Kona?
am I spelling it wrong?
Could be Kona.
They're expensive. Like I don't know how. I know I see a lot of nurses wear them, but I don't know how to spell it.
Well, and I'm not sure from a diabetes standpoint, like what is the arch support or and all.
Yeah.
That.
No, I'm comparing prices. Like those are very expensive shoes.
That I would know.
Yeah, could be.
And so if someone were to think, oh wow, that's expensive.
Yeah.
There's other shoes on
more expensive. Yeah. It may not be the right fit too. So you never know. And I always tell patients always measure shoe size because you could be wearing the wrong shoe size, and that could be a problem too.
Do you go over the arch supports like and stuff like when you're doing your exam? Like if you were going to do the diabetic shoes, would you go like explain like the arch support and stuff like that?
Yeah.
I guess the things inside mold kind of to your feet.
They heat moldable inserts.
That's cool.
Yeah. And then for like patients that, if it's expensive insurance don't cover it, we have other inserts that we dispense in our office, over the counter ones that are better than Dr. Scholl's, that you can slip in your athletic shoes, that will provide good support too, like if you're working and on your feet a lot, those kind of things. We also have specially formulated diabetic foot lotions that we dispense in our office. We have nail fungus medicines. We have what else? We have a lot of antifungal stuff, that we have a lot of over the counter stuff that we could dispense in our office for patients that may need some stuff. Yeah, we could also order diabetic shoes. The diabetic socks from our office too, and all that kind of stuff.
Thank you so much for watching this episode of the Diabetic Defenders, Building Your Defense Against Diabetes. We hope you'll join us for the rest of the series as well. Click subscribe on the Facebook page or Instagram and YouTube, as well as Twitter. We look forward to seeing you next time. Bye.